places would be those locations where we can be engaged. A festival in a city park, having access to a library, not just during the workday, but hey, how about on evenings and weekends? Places where people could convene either formally or informally to see each other and converse. And so that would be the first part of civic health. And believe it or not, USDA has grants to placemake. And placemaking is an effort now underway, especially in rural areas where maybe there aren't the places that once were but could be.
Civic health is defined as the way communities are organized to define and address public problems. The Robert Wood Foundation has been collecting research for many years that shows a little over 50% of our health is related to places that we live, learn, work, play, and pray. According to Elaine Johannes, Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University, research also indicates that being civically engaged in one's community is connected to living longer. On today's Sound Living, the connection between healthy communities and personal health. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Johannes says there are a number of ways to be civically engaged on the local level. Elaine, one of the things that we're hearing more about recently is civic health, and really I guess that's just kind of communities trying to be organized and really defining their path forward.
Yeah, Jeff, you're right. It's amazing what affects our health. It really is. When we start to investigate, yes, we know that we need to get our checkups and we need to get our teeth checked and our hearing and vaccinations, of course, but that's only a part of our health. The Robert Wood Johnson Foundation has done quite a bit of research over the years that actually affirms that a little bit over 50% of our overall health is related to the places that we live, learn, work, play, and pray, and also the people around us. I think the effects of the pandemic have affirmed that we are a species that likes connection, and we do need to have places where we can be connected. There is some research around being attached to our communities and how healthy that is and how we actually have longer lifespan if we are connected to our communities. So being civically engaged, being aware of opportunities to volunteer, to be involved with our clubs, organizations, that's part of civic health.
What we're talking about is the civic infrastructure and then the civic participation.
Yes. Actually, I think we could parse that out into 3 areas. And the County Health Rankings, which is a wonderful group out of the University of Wisconsin, analyzes our civic health as a state every year. So civic health is parsed out in what I would call places, processes, people. And places would be those locations where we can be engaged. A festival in a city park, having access to a library, not just during the workday, but hey, how about on evenings and weekends? Places where people could convene either formally or informally to see each other and converse. And so that would be the first part of civic health. Do people have a place that they could do that? And believe it or not, USDA has grants to placemake. And placemaking is an effort now underway, especially in rural areas where maybe there aren't the places that once were but could be. The second P, the processes in that community. And some of those civic health processes could be, how do we vote? How often do we vote? The process of being elected. Hey, wouldn't that be great? We could all run for either a council, a committee, a civic entity. So the processes that people are engaged with to have their voices heard, and processes that also are remote. How about, are there opportunities for people to do a Zoom event and talk with their elected officials? Processes such as that. And then the last P, the people, the volunteers, the people who participate, the people who don't shelter in their home after 5 when they get home or just don't volunteer. So if we have the places, the processes, and the people who are socially engaged, the capital, the social capital in the community is fairly strong. then our overall health as a community goes up. And there's research about that.
Well, and we're also finding through extension that this is contributing to community vitality.
Absolutely. Many of our faculty here at the university and our professionals out across the state in the extension offices are connected to the community vitality work of extension. They're being trained, and they do the facilitation in communities, convening people, talking about the important issues of the day, but also from a program perspective, the community vitality staff and specialists have a program that equips people to actually serve on boards. It's an onboarding course. Don't be afraid of the word course. It's not a grade, but it is good material. It takes some time. It's led by people who have served on boards and actually organized boards. So the onboarding, welcome on board kind of effort equips people to understand, how does democracy work from even a board perspective? And Jeff, that's really what we're talking about. How can we in the state and in the communities that actually comprise the state strengthen our connection to the civic roles that we all have? Democracy works well when we all work for it. Case in point, several of us are involved with discussions now around how to do deliberative dialogues, around being civically engaged, around having more places where people can be exercising their civic chores, but also having the culture and the identity of the community through opportunities to have a festival or to have a convening and celebrate who we are. Those deliberative dialogues could be happening quite soon. I know that we're looking at how do the dialogues around these pressing health issues occur. And in order to do that, you have to have the people and you have the process of how do we dialogue, and then you have to have the places. So back to what comprises civic health, those three areas.
We mentioned community vitality. There's also K-State 105. Does this play into this as well?
Oh, Jeff, yes. When we think about the mission of K-State University and with good extension support, creating opportunities for a vibrant workforce, a robust economy, a community that thrives, no matter if they're urban, rural, wherever they are in the state. And so we need the people in the process to make that occur. We need them to have skill, to have understanding, and also the opportunity to participate. And that gets to the barriers. The Kansas Health Rankings data shows that Kansas does have barriers. We really do. And some of those barriers are the infrastructure, the place itself, drive time, transportation, internet. Even do we have a post office that's open that I can get my mail? How about the paper, the local paper that gives local news? So these kinds of barriers are limiting to our civic health, and we need to be active around alleviating the barriers. Kansas is among some of those rural states that have barriers that we may not be aware of how detrimental they are to our overall community health. But again, we need to have the people in the place that understand the processes to alleviate those barriers.
I know one of those big barriers is childcare.
Oh, my goodness. That's another issue that isn't just relegated to one solution, is it? Places, right? Okay, where do those little people go when mom and dad and aunt and grandma are at work or other occupied? So we need a healthy place, child care being one. But we need to also have the processes to put that place there. So it may take a committee, a volunteer committee, to look at green space in the town and say, can we build something? I remember the work of Tricia Green, who's one of our faculty members down in 21 Central, which is a district that covers Edwards and Stafford counties. She convened a volunteer action committee to look at spaces where they could bring mobile homes in and retrofit those to the place to make childcare slots. Okay, that's a place, making places, processes. Oh, yeah, she and her team had to learn a lot. But the people, Jeff, the people were able to get 6, they called them daycare, but they are really very vibrant childhood education centers going on where 2 years ago they didn't exist. So again, the civic health around childcare, again, places, processes, people. I believe that Tricia and her counterparts are a lot more healthy now since they know where those little people are going through the day.
Well, it's interesting as you're talking, I'm thinking that in a way this almost seems more suited to the rural communities because it seems like they would be a little bit easier to organize, understand the issues of the community as opposed to maybe some of the metropolitan areas.
Yeah, oh my word. When I have conversed with our agents in Metro, the complexity, Jeff, of that place and all the different agencies, organizations, but then also how do people get access to those? The transportation issues in urban and metro communities are vast, as are those in rural and frontier, but they're different. How does somebody in an inner city, Wyandotte County, get clear down to Johnson County because maybe there's a regional effort going on and they want to participate? How does that occur given the complexities of how does the bus route go and how do I make connections and the number of cars and, how do we exchange everything? So there are some nuances, some changes, some unique barriers to being civically engaged to improve civic health in urban metro communities. There are those that there are some changes between how Kansas City, Kansas conducts its civic health and governance to the Missouri side. But we have people and families going back and forth. I think of the work that Kate and Dale are doing down in Cherokee County, where they're trying to weave together agencies and programs to support people who need a job, who need housing. And they're working even across the state line because families are moving across state lines, county lines. And how does our civic health accommodate the realities of families that don't know that they only have a geography that's an invisible line between a county? So again, I think Extension has a role to educate for sure. How does government work? Local. How do we participate? Yes. And then how do we make sure there are places that lack barriers but are accessible, either physically accessible or socially accessible for us to be involved? So the bottom line would be then our involvement and our civic voice leads to our collective health. So we all thrive, and our workforce as well, and our children thrive.
We've only kind of touched the surface, but there are a couple of reports that people could go check out if they would really like to jump in and really learn about civic health.
Yes. Probably one that is of interest is definitely going to the county's health rankings website. If you just Google that and then look for civic health, you will find the 2023 Civic Health Report for the United States. What is really powerful, Jeff, is that you can go into that report. It has an interactive map. You can click on our state. You can click on a county, and you could see some of the variables, elements, parts of what civic health is like in our state, and some of the worry points. The other thing is that the Conference for Citizen Engagement puts out a report periodically about the nation's civic health, and the 2021 report on the Civic Health Index is also very helpful. The Kansas Health Foundation back in 2016 worked with this conference group to create a Kansas report around indicators of not only our voting, how many of us volunteer, how many of us participate on boards, advisory groups, how many festivals and cultural events do we have we can all come together and create place. So there are those three reports. First one, the County Health Rankings, most recent 2023, the 2016 Kansas report, but right between there is the 2021 National Report for the nation's civic health.
That's Elaine Johannes, Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University, with information on the benefits associated with being civically engaged. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.